presidential aspirant under the coalition of political parties, Adewale Adebayo, has urged Nigerians to understand the importance of alternative medicine as a major development to understand natural resources. He made this known at the book launch titled Healing Plants of Nigeria. He says there is need for public investment for plants, as this will help to boost healthy living.
So in terms of medicine, we've earned our stripes. But like everything that challenges us when you are dealing with the oral tradition, and now we are thinking in terms of Western methods of knowledge acquisition, we tend to assume that those herbalists of yore and those who were taking care of our public health were just guessing. They were not guessing. And what this book has shown us is that we can retrace some of the thinking processes and practices that allow them to be able to discover in our flora and some aspect of our fauna medicinal properties that we have been using to take care of ourselves.
Guest speaker at the occasion and the governor of Imo State says there is need to bring traditional medicine out of the shadows by formalizing the practice, adding that the recognition for traditional medicine will help to scale up opportunities in the global market.
And I also think in our primary healthcare centers, we can provide with this one room where a TMP can carry out some of his activities. Remember, I said I don't believe in integration. Don't ask the medical doctor to dabble into it. Let him have a room where he can provide services to his people. Then for the herbal medicines, we should begin to document. We should have a national systematic documentation. The authors of this book have provided some documentation. The Nigerian Herbal Pharmacopoeia, some documentation. Nigerian Natural Medicine Development Agency, some documentation. As a nation, what format do we want our documentation to take? I like the one that I have seen in this book because it combines practice and plant information. We need to find a way of creating that for the country. And then if I work as Kule, if Professor Edu works, let's now put it into that structure so that we have a one place we can go to and ensure that we have the information.
Necessity is the mother of invention. After the COVID-19 pandemic broke out, and the country was taken unawares, every responsible mind in the country, including policymakers, are now interested on how to secure our country health-wise. And that is the reason most of us now are supporting every research, all materials, all works, towards having a homegrown solution to illness like all these viruses and all that. And it is through our local herbs that our researchers will process and bring out this solution. So for me, it is something that we must take very seriously.
However, the Minister of State for Health, who was represented by the Director of Traditional Complementary and Medicine, Federal Ministry of Health, added that the federal government is determined to develop and promote traditional medicine sector in the country through thorough research, as there has been global resurgence in the use of herbal medicine.
It is also estimated that about 80% of the population that live in the rural areas of developing nations rely on herbal medicines for their primary health care needs. We said we want to promote primary health care. Every day they say we want to promote them. Where is the traditional medicine content in promoting primary health care? It's not there. So you cannot and you will not achieve it. The global medicine market size was estimated to be about 100 million, even billion in 2019, and is expected to reach 550 billion by 2030.
The high point of the event was the launch of the book titled Healing Plants of Nigeria. Kike Lomo Okeri, Ko TV News, Abuja.